Welcome to today's webinar about the new normal. I'm Stephen Bader. I'm Executive Director of the East Bay Economic Development Alliance, or as we call ourselves, East Bay EDA. We're really looking forward to today's topic because it's really timely, and of course, as we get to this point of coming on the other side now, finally, of the COVID-19 pandemic. A little bit about East Bay EDA, if you're not already familiar with us. We are a regional economic development organization focused on a variety of issues pertaining to business climate, education and talent, land use and infrastructure, and a variety of other things affecting the economic vitality and quality of life in the East Bay. We're really happy to have a great panel assembled today to talk about the COVID-19 sort of aftermath and what is it going to be like to be part of this new normal. We have a fantastic group, and the group's going to be moderated by Kim McCarl, who's the Communications Officer for Contra Costa Health Services, which a role she's been in for a little over a year now. She has a background in public information and community relations, working for a variety of public organizations, including serving for a couple of local organizations here in the East Bay. She worked as communications director as well for the North Carolina Department of Commerce and managed economic development announcements for the governor at the time as well. So Kim, we're going to turn it over to you to introduce our great panel and get us going.
Great, thank you, Stephen. You're right, this is a really esteemed panel and I'm really honored to be here with everybody this morning. So first, let me introduce Erin Ortiz. Erin is the Chief Executive Officer for La Familia Counseling Services. And then we have Dr. Laura Miller, who is the Chief Medical Officer for the Community Health Center Network. After that, we have Patrick Kallerman, who is the Vice President of Research for the Bay Area Council Economic Institute, and Dr. Michael Stacey, who's the Chief Medical Officer for Lifelong Medical Care. We're really excited to start with a couple of questions that we have already been submitted, but then we're going to open it up. So if you have questions, we really invite you to participate through the Q&A and through the chat function. We'll have everybody kind of talk a little bit about what their organizations do and go through these couple questions. And then we really want to make sure that we have an opportunity to interact with those of you who are with us today. So let us just jump right in if that's okay. I'm going to start by asking each one of you to tell us a little bit about your organization, where you operate, the efforts you've led during the pandemic, kind of what role you've taken. So Erin, let's start with you and La Familia Counseling Services.
You got it. Well, good morning, everyone. First of all, I'd like to say thank you to the East Bay EDA, Stephen Bader, your team for putting this together. I think it's a great dialogue to have. And of course, I'd like to thank the staff of La Familia. With that, La Familia has been involved with providing, various types of efforts since the beginning of the pandemic. We partnered with some of our friends here around the table, CHC and also Lifelong. Please tell David I said hello. Michael, and others, just because we knew that this was a joint effort. We've been around the table, whether it's been research, again, trying to figure out what are the data points that we need to figure out for our most vulnerable communities. And in addition to that, doing testing and also vaccinations. La Familia has vaccinated 90,000 people in Alameda County, and over 20,000 vaccinations here in Alameda County as well. And in Contra Costa County, we've led various efforts to make sure Latino serving agencies are getting their populations vaccinated. So it's been a great partnership all around. I think some of the key areas that we need to keep focusing on are coordination and really being innovative in making sure that we're reaching and continuing to do outreach. We all have the vaccine. We've already done the product placement. Everyone who wanted to take the vaccine took it. What we need to do at this point is get people to take the vaccine. That requires outreach and education. We need to get people to the product, to the vaccine, and make sure they feel safe and can make an informed decision about which vaccine or if they want to take it. So pleasure to be here. Thank you to our partners around the table. Pleasure.
Thank you, Erin. 90,000 vaccines, that's really impressive. We appreciate the effort there. Let's have Laura from the Community Health Center Network go next.
Sure, and I echo Erin's thanks for being here. We had a fun time planning the panel and I'm looking forward to a really good day. So I'm with Community Health Center Network. We are a managed care services organization. So essentially insurance, managed care, and we do that on behalf of 8 of the federally qualified health centers in the East Bay, of which Lifelong is one, La Clinica is another. And we have 140,000 members, but our health centers take care of over 270,000 individuals. The health centers are located in Alameda County, as well as Lifelong and La Clinica have sites in Contra, Costa, and indeed La Clinica has a site in Solano County. So, and one of our other health centers, Bach, is now in Santa Clara. So our footprint is growing. Really from the beginning of the pandemic, it was setting the table, gathering people, best practice sharing, and figuring it out. It took a lot to do that. We were all dealing with something we'd never seen before. So we dealt with the shortage of test kits from the very beginning. And then when we were able to get more test kits, we shared throughout, and we shared expertise. And then we've also done contact tracing. It's an area that the health centers were never involved in before, this intimate linkage with the public health department to do what has been traditionally a public health department function. But again, our health centers took that on in part because they are so intimately related with the communities that they serve. And then in terms of vaccination, much like Erin was saying, we've been providing vaccine to everybody and anybody. Initially, it was that concern around supply. And then there was 1 week in April where everything flipped and, supply really increased tremendously. So again, I think our challenges are how do we get vaccine to those who still have questions, and how do we be really, really respectful of the questions that people still have? We cannot just say, do it because I say. There's a lot of reasons for mistrust, and we have to understand those. And then the other thing I think that we're really looking at is what happened in the intervening year and a half. How much healthcare maintenance has gone by the wayside? What are the traumas that our patients faced that now have sequelae that we are going to be caring for as we move forward through the decades? So those are some of the things that I think about as I work with the 8 health centers that we work for.
Thank you. So Patrick, I'm going to call on you next to talk to us a little bit about the Bay Area Council Economic Institute.
Thanks so much, Kim. Yeah, hi everyone. I'm Patrick Kallerman. I'm the Vice President of Research at the Bay Area Council Economic Institute. But because I like having 2 jobs, I'm also the healthcare lead for the Bay Area Council. Kind of a distinction without a difference, but sometimes there's a difference. And in a year like we had, there was a difference. The Bay Area Council represents 300 or so of the region's largest employers. And as such, when it became clear the pandemic was really going to take hold and shelter-in-place orders were going to last longer than anyone originally imagined, we kind of sprung into action to relay the advice from many of our members are some of the region's largest healthcare providers. We also have ties very close to both state and local government, and so we did our best to serve as a bridge or an interpreter or whatever form you want to imagine this took between all of those parties and business. And so we continued to do that throughout the year. We continued to help sort of especially early on, businesses understand what they needed to do and keep them running and keep the region sort of functioning to the best of its ability where possible. And then later on, our healthcare committee launched a very concerted effort to closely work with public health officials, and Kim and I worked together very closely for quite a while there to kind of continue this outreach and education, particularly among the disproportionately affected and disadvantaged, to get the best advice as things started to reopening, as vaccines started to become available, all of those types of things. And so we continue to work on that, particularly through employer to employee communications. Our members employ several million of the region's citizens. And so, yeah, that's kind of what we've been working on.
one of the things, I'll just take a moment. One of the things I've been super impressed about are the people who've really stepped up to the table in this crazy time. And so, Patrick, I don't know what kind of opportunity there would have been to partner in normal times, but I really look forward to continuing the partnership because it's been super interesting and I've learned a lot. And I will say, Michael, Lifelong Medical has been a huge partner to Contra Costa Health Services, and I appreciate that. Give you an opportunity to tell us a little bit about Lifelong Medical.
Great, thank you, and thank you for having me here. And it's great to be on this panel with all of you. Lifelong Medical Care has been around for about 45 years. Started in Berkeley, currently serves over 60,000 patients at over 30 locations. We provide medical, behavioral health, dental services, recovery and support services as well. A lot of work among homeless populations in the Bay Area. We have street medicine teams that go out and provide medical care at homeless encampments. We're also a teaching health center, recently started a family medicine residency program. We have a nurse practitioner residency program, and we do train behavioral health providers as well through some collaborations with UC Berkeley. Our mission is really based on a framework of social justice and health equity and to serve our communities. We're connected to the communities, and we've been, just like other panelist members and organizations, we've been uniquely situated to provide services to our communities during this pandemic. One of the things that was a big transition for us and other federally qualified health centers was making sure that we could still provide regular services to our patients. And so we made a big transition to telehealth so that we could actually provide these services. We continue to do this, and this is a big issue because we want to be able to continue to do that going forward, even after COVID, because this provides a way that we can provide better service to our communities. Testing, early on was something that we did a lot of, and we partnered with the Innovative Genomics Institute at UC Berkeley, the Jennifer Dauda's lab, who recently received a Nobel Prize for her gene editing technology. And they've been providing us PCR testing for COVID. That's been a great partnership. And we've partnered with both Contra Costa counties and Alameda counties to provide testing in the communities. And those have also been wonderful. Also with vaccination, we provide vaccination at fixed sites, partnerships with community-based organizations and mobile testing. And again, our street medicine teams go out and have provided testing and vaccination in homeless encampments. Initially our vaccination efforts were really crowd control. But now it's really about, as Aaron and Laura both pointed out, it's now getting to those other harder to reach people who still need to be vaccinated. And, so we will continue to do that work in partnership with the counties and other community-based organizations. And then I do think it's really important, what Laura also pointed out, is during this recovery period, there's a lot of deferred management of chronic diseases that we need to address, and a lot of trauma, mental health issues that we need to address. And then, I think we're still learning about long COVID, and that's really the sequelae or health effects of COVID that are actually long lasting beyond just the initial hospitalization and severe COVID disease. People have symptoms for a long time. And so we're going to be learning about that and needing to provide services to our community to address long COVID. Grateful for the connections that and the collaborations with our local health departments that we've made during the pandemic. For example, one thing that I was able to do with Alameda County during the fall and months was provide some services to provide health officer services to Alameda County. And that gave me some insight into the tremendous amount of work that our health departments are doing during this time and the heavy lift that it's been. And so I do believe that these collaborations and partnerships that we've built with our health departments are going to really serve us well going forward, both for future emergencies, but also just in kind of day-to-day working to serve our communities. So thank you to our health departments as well.
Great. So I have one more round robin question. The question is, as more people are getting vaccinated and businesses are opening, what new issues are emerging around opening strategies in day-to-day activities? So, Michael, since you are already warmed up, we'll start with you this time around.
Yeah, so getting back to day-to-day normal operations, that's something that we are definitely grappling with, both in how we provide the service to our communities and just how we, how our employees come to work. Or there's, I think, as with many sectors, we had a big transition to people working from home. We temporarily closed some of our sites and consolidated services. We've now reopened all of our sites and have gotten back to kind of a middle ground where we're providing some in-person services and telehealth services, but still spacing people out, masking within the workplace. We're looking forward as, next week when June 15th hits, and some of those regulations are relaxed, and with new Cal OSHA guidance coming out, how we are going to get more people back to the office and provide a safe environment for people to work in, get some of our patients to come back so we can check their blood pressures and their weights and get back to managing their chronic diseases. So we're actively working on creating those practices and protocols within our organization to make all of that happen.
Great. Laura, I'll call on you next around what opening strategies and day-to-day activities are emerging.
Sure, I think I echo Michael in that, when I look at my organization, CHCN, we're primarily administrative. We flipped on a dime to get everybody home in March of 2020. And then how do we get people to come back? What does that look like? I think we're in a very interesting time in terms of employment. I think there was an article in the New York Times just this weekend about how employees have the upper hand. I think that we're going to see a lot of movement post-pandemic, people who kind of sheltered in place in their jobs. And now they're poking their heads up and saying, hey, I could go elsewhere. So I think there's just a lot of movement going on, and we're seeing that for sure. What will the office look like? Will we mandate that people come back? Will they want to come back? Is it going to be one day a week? How do we space people out in the office? All of those pieces, I think, are very, very interesting. On the clinical side, one of the things, and I do see patients at Lifelong, I'm trying to figure out, okay, I can do telehealth with somebody, or I could see them. When do I need to see them? What do they want to do? And how do we figure out that balance? One of the things that was so incredible with telehealth is that no-show rates went down. So that convenience factor for patients is huge. Now, commercially insured folks at Kaiser have a lot of video visit and telephone visit options. Our patients in the federally qualified health centers never did until the public health emergency because of how the funding goes. Well, now we can be reimbursed the same for telehealth, audio, video, or in person. So we have those choices. And how do we figure that out? Both clinically, what do I need as the provider? What does the patient want? And what do we need to do? So those are things that I think we're definitely thinking about.
Yeah, really interesting things to think about. I think about it in terms of my own personal health care too, right? Do I prefer a telehealth visit, or is it time to go see my doctor? So really, really great points. Erin, next in terms of what you guys are seeing around opening strategies and day-to-day activities.
You got it. I really appreciate this question. I'm going to go back a little bit. I remember when the pandemic started to the T. I was on vacation and I thought to myself, wow, the toilet paper is running out at Costco, right? And all jokes aside, I thought to myself, we need to put an emergency response team together ASAP. It's my second day of vacation. And by the third day, I said to my wife, we need to fly back. I was scared they were going to ground the airplanes, and I didn't know what was going to happen to the work that we do. Fast forward, I think that we're still in transition. I think that we need to start having the conversation that this is probably going to be an endemic and that this is here to stay and that the ground will probably continue to shift underneath us. What we're doing right now is rolling out slow. We're mandating for staff to come back 1 day a week and be able to work remotely and be able to provide, telehealth, both via video or via phone. I think that a lot of this is going to be determined by our contracts, whether you're talking about an FQHC or whether you're talking about agencies that do the work and are Medi-Cal based, and those are the billable contracts that they have, right? If our funders are going to be open to us, working remotely and being able to have a high, productivity level, areas of efficiency, and areas of high quality services. And I think that those are going to be some of the measuring sticks that we have in this, but I think we need to take it slow. I think that our respective organizations need to have hybrid programs. We're not requiring anybody to come full-time till August 15th, but also we're coming up against the school years, right? Starting again. We have to be very upfront that some of our employees are going to need childcare support. And how do we work around that? But also some of these areas may cause microeconomies to happen. We understand that we do need to come back to work, but we need to do it in a methodical, thoughtful way where we can make sure we still meet productivity. We can still meet the needs of our respective staff because, we live in the Bay Area. Half of our staff probably come from Sacramento or the Valley, right? They're commuters and we need to be sensitive to that. So I think that, as a region, as a collective, these are going to be conversations that we need to have. These are going to be contract negotiations that our respective organizations need to have, but also we need to have more public and private partnerships to figure out how do we mediate some of this? How do we make sure that we continue to be part of the solution and focus on some of the areas that are going to happen around this? Here's the caveat, team. Right now, we need to figure out when is this going to be FDA approved, meaning the vaccine. If you're in the medical field right now, you have to take a flu shot to do the work that you do. Right now, it's not mandated as employers for us to do that. That's going to be another caveat and another bridge that we're going to have to pass. And we're going to have to be sensitive to it because when these conversations came up, in each of our organizations, there were people for many reasons, right? Religious or medical that didn't want to take the vaccine. And again, these will be the conversations we need to ask ourselves. I think lastly, when we talk about the social determinants of health, I think that needs to be a barometer on how we evaluate this as employers to get back to a healthy workforce that can work in a hybrid structure.
That's really fascinating. I think you're absolutely right about the social determinants of health. I think that's something we were thinking about before the pandemic hit. And in a lot of ways, the pandemic has really laid bare some of the shortcomings and some of the things that we do well. So I think lots of opportunity to do some work there. So Patrick, really curious about your perspective on this topic.
Yeah, all great points. And what I'll say is I agree with Aaron. And I think that my comments fall into two buckets. One, this is a transitionary period. And so as such, I think, we're working on a variety of projects, both public and private, where we're doing extensive interviews with employers across the region and asking them effectively this exact question to figure out how things are going. And I think, in the first bucket is this transitionary time, right? I think that all of the employers, first and foremost, want to keep their employees safe, want to do the best they can for the region, and want to follow public health advice. And so I think that they're doing their best to kind of weigh, when should we come back? How can we strictly follow these guidelines? Some of the guidelines are, maybe not for the largest, kind of white collar employees, but for others, some of the guidelines are getting a little confusing, and we can talk about that a little bit later. but, they're, just very slowly easing back into things, right? I mean, we've been doing this for a year and change now, so I don't sense a really particularly big rush, right? Even though a good portion of the population is now vaccinated, there's still a good portion that isn't. And so I don't sense a huge rush among the largest employers to kind of put something back together very quickly, right? I think everyone's just doing their part to be cautious and contribute to the public good the best they can. Then going forward, as Laura mentioned, I mean, I think that at some point this will become a little bit of a brave new world. I mean, I think that after, working remote for over a year, some of the structures have started to change, and the employees have, taken back a little bit of power and have said, like, we, the multi-hour commute each ways are difficult. The juggling work and personal life and childcare responsibilities and caregiving responsibilities and just, existing is pretty difficult, or was pretty difficult before. And so I think that many of them are thinking about this, many of the employers are thinking about this in a way that, is trying to help alleviate some of those pressures, right? I mean, you heard before, day in and day out, there were articles in the Bay Area about how, quality of life here was getting more and more difficult. And so to the extent a hybrid work model can alleviate some of that, I think that would be amazing. I will say that, there's also all of these articles about, an exodus, and folks are leaving because they're just going to give up on here because that, quality of life was declining and things were so difficult, and now we can be remote forever. And I just don't think that that's going to largely be the case. I mean, sure, you're going to hear an anecdote here or there, or a company here or there is going to do that. I think that going fully remote presents a surprising number of problems that, will have to be worked out. But when we're talking with employers, I mean, first and foremost, they're here for a reason. They want to remain in the region for a reason, and their talents here and the ability of their talent to get together, once or twice a week, maybe not 5 times a week anymore, is still of the utmost importance. And employees are saying that they need that too.
Yes, I think that's really interesting. I just came back from a vacation where I drove through Boise, Idaho, and I felt like I sort of needed to take the California license plates off my car, because there is this impression of this exodus and the driving of property values, because people from California are moving that way. So Patrick, I'm going to keep you on the hot seat just a little bit. You talked a little bit about the partnership and the work that you and I have been doing for, it's crazy to think now it's been almost a year, but it really has been almost a year. And I think we all have really learned a lesson about the tie between public health and the economy, and how closely tied they can be. So I'm really curious your perspective about what needs to be done differently in the future to better connect economic development and public health, so that we're better prepared if something like this, or not even if something like this happens, but just on an ongoing basis. I guess both perspectives would be interesting to me.
Yeah, that's a fantastic question. And I think, each employer might give their own answer, but from, sort of our perspective, one of the reasons the Bay Area Council's Healthcare Committee was created was Affordable Care Act implementation. And the business community really got together and said, we're interested in, participating, right, effectively. And so, I think going forward, I think that folks realize more than ever the importance of public health, right? I mean, in some ways, this is going to hopefully usher in a new understanding, a new appreciation, and sort of a new era for like which we should have all been doing before, but just appreciation of our public health system and public health officials and the healthcare system as a whole. Actually, I mean, the private folks doing the amazing work too. And so, I think that our members are all saying that they support, increased investment in public health, increased interaction between the public health officials and the dialogue. And they want that, they're all looking for ways to kind of stay more engaged and involved and want to hear more, and it'll be interesting to see how that happens, right? I mean, because they are in the business of providing whatever good or service they provide, and so the bandwidth to participate sometimes gets eaten up by just the day-to-day, work of doing, the business you're in. But there's certainly a vastly expanded appreciation. And I think going forward, hopefully we can keep these ties from atrophying, and we can keep public investment solid.
Yeah, I think you're absolutely right about getting eaten up in the day-to-day that needs to go on. And so I think I would agree with you that there's opportunity for us to maintain that partnership and make resources available to businesses across our community. I just want to check with the other panelists if anybody has anything to add on that perspective. I want to encourage you all to jump in. Laura, I see that you've taken yourself off mute.
Yeah, no, I think one of the things that we realized that we should have known is that public health infrastructure is really essential. I'm looking in my office, I have a certificate of appreciation for being a sentinel testing site during the H1N1, the swine flu. And we prepared for that. And I was testing people who randomly came in East Oakland. There was nothing like that for it's in terms of surveillance out in the clinics in 2020, late 2019, 2020. Michael will remember doing tabletop exercises of how would we respond as clinics if there happened to be an evil airborne virus. Those blueprints for those tabletop exercises were dusty and forgotten when COVID came through. So I think we really realized that shucks darn, we need to fund public health infrastructure. So I think that's there. I think that's really important. And I think, again, it's like, how do we carry that forward? I think another piece as I think about this is, I will admit, I did not think of grocery store workers as essential workers. I didn't. I think we have a whole new appreciation for who are the workers who keep us going. And I don't know yet how we're going to meld that into our thinking as a society. But I know certainly in my own parlance, essential worker is now definitely something very important. I mean, if you look at what happened even with meatpacking plants, right? COVID tore through those very bad working conditions. And people were getting freaked out about lack of, hamburger. So I think we definitely learned a lot.
We did. I'm gonna veer from our plan a little bit. We have some questions in the Q&A actually about resources and having enough resources. And I think this would be an interesting time to talk a little bit about resources. There's two of them. One of them has to do with do we have enough resources for our clients and patients to really take advantage of telehealth? And then a question about whether there's enough resources and funding to really do the kind of robust outreach and education that needs to be done. So curious about your perspectives, particularly from the clinics, but Erin, I invite you into the conversation as well about resources and availability of resources to do this work.
Yeah, I think it's interesting times. Right now, through the American, Rescue Plan, a lot of our counties are being flooded with money. You look at Contra Costa County, it's upwards of 220 million. You look at Alameda County, it's upwards of 330 million. And the counties right now are trying to figure out, how do we strategize? How do we plan for this? The FQHCs through HRSA, they've been given specific, allotments to do areas of work. So I think that the resources are there. I think connecting left and right are the key. And I think that also we need to build upon the relationships that have, come about due to this crisis. You look at the work that we've done with Laura and, Michael through Resilient Fruitvale. There's been huge partnership there. It's been a collective impact model. And I think we need to expand upon that. I really think we need to look at a regional task force, both, between Alicoco, and really look at what we can do, whether it's, it sits here with the EDA or whether it sits wherever it may sit but really expand on, public health, as Laura was alluding to, and building both our nursing, our EMT programs to meet the need. I think that we've all been used to working inside of our walls. I think that this has got us awake in the sense of we have to work outside of our walls and we need to be more mobile. and really work in micro communities to really hit it up, if you will, block by block, street by street, and get these people vaccinated. But the key will rely in the partnerships and making sure that we can expand on both private and public partnerships to build these micro economies and make sure that we get people connected back into the workforce or transferred. What we call workforce development. I worked for the state of California for 10 years, employment development department, and we used to call them dislocated workers, right? I think Kim and Steve and some of the other folks around the table can relate. I think that we're going to have to look at what's on the horizon as well. Biden right now is looking at an infrastructure bill, and hopefully both our Democratic friends and our Republican friends get this passed, make something happen. We know that this is also going to lead to jobs, and I think that infrastructure can also lead to health. We're America. That's what we do. We think of creative solutions and we lead the world, and I think that's where we need to continue to lead from.
So, Michael, I particularly want to call on you a little bit to talk about telehealth and whether you think the resources are available, particularly for the communities that you serve, which will then lead us into our next question about equity. So I think that's an issue that you all deal with all the time. So I'll turn it over to you.
Yeah, and just, kind of a backdrop to those comments, I just want to say that, one of the things that I think has also been highlighted by the pandemic is the connectedness of our communities. And actually, I think that's true globally. If we're going to control this pandemic, it's not something we can control in the US alone. We have to control it across the world. And it's not under control all over the world. And then even taking that down to the US level, we need to control it across the US. And then even taking it all the way down to California and the Bay Area, we can't leave any of our communities out if we're truly going to control the pandemic. And we know that vaccination rates, for example, are not even equally spread across the area. And so that affects our ability to control and get back to this new normal. And just to build upon what Aaron and others have said just about the resources and how they're deployed. We do have lots of resources, and those resources are in the form of money, and it's transforming the money into building and mobilizing services. That's the challenge. And how do you do that? How do you do that quickly and efficiently? And I think that's where the partnerships come in. That's where I think, CBOs like La Familia and, FQHCs like Lifelong and others, La Clinica and others across the Bay Area are able to mobilize a little bit more quickly and rapidly than, potentially some of the government, but that's where the partnerships come in, and we're doing that, in multiple partnerships. And then to the telehealth question, we have certainly, I think our patients have benefited from us being able to provide services in that way. I know for me personally, I much prefer to be able to call my doctor or do a visit over video. It's way easier. And most of the time it's sufficient for what I need. Why do we think that patients who are Medi-Cal or who are uninsured shouldn't also be able to call their provider and receive services in that way? We've been able to do that during the pandemic. We do that both by video and telephone. It is true that some patients are not able to do that because they don't have access to Wi-Fi. And most people have telephone access, but not everybody has Wi-Fi access for doing those video visits. So there is an issue right now that is in the legislation that is critical for us, because some of our patients, we're trying to do as much as we can over video, but some of our patients both don't, like I said, don't have Wi-Fi access, don't have the bandwidth to be able to do something over video. Sometimes there's situations where people don't actually want to be on video because of their home situation. You know, they don't necessarily want that all on video for their provider to see. And so telephone only visits and being able to provide care to patients by telephone is also really critical. And we've been able to do that during the emergency declaration for the pandemic. But when that emergency declaration ends, potentially our ability to provide services and get paid for those services may also end unless our state legislators act and pass something that allows us to continue to get funding for those services. And that is a critical way that we provide services to the most vulnerable communities. And we want to be able to continue to do that. So that is a critical thing that we are lobbying for and pushing for in our state legislature. And so any support we can get to do that, because I think it is critical. And again, back to the point that our communities are connected. So us being able to provide those services to the most vulnerable communities makes our whole community stronger. And, you know, the pandemic has taught us that we rely on people that work in the grocery stores. We rely on people that, you know, deliver packages to us. And so leaving them out in any sort of recovery will just slow our recovery and makes us a weaker, you know, society and Bay Area overall.
That's great. I couldn't agree more. I think you're absolutely right. I think we've all, in our different ways, seen the impact, the disproportionate impact on some of our historically marginalized communities. And I want to make sure that we talk a little bit about equity and how we build that into the recovery from the pandemic. So I'll just open it up to anybody who has a thought about that. I know you're all steeped in this on a daily basis, and so I'm sure I'm not going to hang for an answer, but just really wondering about, you know, how do we really build that equity piece in, because this is not an issue that, this is an issue that existed before. It was very obvious to us in the midst of the pandemic. It's very obvious to us now. And I think we really need to think strongly about what we do with it going forward. And so, Laura, I see that you've come off mute.
Yeah, no, I really appreciate that question. And as we talked about this, I think I said in one of our prep calls, normal wasn't so good for everybody. So, you know, the old normal is not a goal. And really for me, I think that new normal does really have equity as its North Star, if you will. And again, you said it, Kim, COVID shone a very bright, stark light on the disparities. If you look at, you know, COVID disease rates in the Fruit Vale, you know, super high. In the mom-speaking community, even higher because of incredibly dense housing. So equity is absolutely important. I think that in some ways for organizations like the FQ's, service to communities that are traditionally underserved is part of our DNA. And I think that we also need to really focus more. I was just in a discussion earlier this morning about how do we build equity into our quality improvement activities. It doesn't mean equal blood pressure control for everybody across the board. I mean, there's goals that you want to get to, but let's look at what groups are suffering more and what do we need to proactively do to support the people who need it more. And that, I think, is an equity framing that we do need to do, and we're beginning to. I think, you know, the other piece that we haven't explicitly mentioned is, you know, the racial reckoning of last summer, and I think that has thrown equity and racial disparity into common parlance. And now what really we have to do is act upon that. It's not just enough to say those words. What you really have to do is create plans and actions that move that forward.
Yep. Go ahead, Kim. I'm sorry.
Nope, I was going to call on you.
You got it. Well, it's, I think it's been tough for all of us. You know, we're all COVID-19 exhausted. We're all, you know, really exhausted when it comes to this work. And yet we know that we need to make changes. And we need to make sure that we're looking at these areas of work through an equity lens and through a DEI lens. At La Familia really embodies equity. It's part of our culture. It's in the work that we do and cross-pollinated through our services. We were born in the Fruitvale. We were actually born at a La Clinica. And our legal name is actually not La Familia, it's the Alliance for Community Wellness. Our DBA is La Familia. And, as we look at this work, what we really need to do is, have those frank conversations, make sure that we have, people of color in leadership positions, make sure that they're, part of the conversation. I always say, if you're not at the table, then most likely, you're on the menu. And I say that with all due respect. I say that in reference to making sure that we're building this leadership, we're building the farm. And I think that both Contra Costa and Alameda County healthcare services and public health have done a great job. I think we're moving in the right direction. I think that we need to continue to keep the focus there because, as we see in Alameda County, we still look at the numbers, and it's Black and brown communities that still have the lowest vaccination rates, which is so hard to digest because we've done so much work to make sure that those particular communities get vaccinated. So again, our finger needs to remain on the pulse, and we need to also support each other, regardless of ethnicity, regardless of color. We need to make sure we are extremely lucky to be here in California and here in the East Bay. We have like-minded people, regardless of creed, that want to work with each other. And I think that we need to have that be our mission, and work again from a point of partnership and not tearing each other down.
Here, I totally agree. Michael, I just want to say that there's a person in the chat who's volunteered to help get permanent funding for telehealth. So I'm going to ask Stephen's team to make note of who that is, and we will reel her in. So we appreciate that. I'm wondering from any of you, perhaps you, Patrick, about what other kinds of policies and actions would really help to ensure that equity is really rolled into the recovery piece.
Well, first, I was also going to earlier voice, our support, and Michael, to the extent that you have information to shoot our way, and the healthcare committee has been contemplating more recently, getting into the kind of telehealth space and how we can support it, primarily for reasons as you described. And so we'd love to be partners on that work with you if we could, and if it makes sense. Our organizations, the employers of the Bay Area Council are just, a lot of things happened last year, and one of which, really pushed many of these organizations over the tipping point where, many were committed to equity before, but many are beginning to understand more, or perhaps at a deeper level, what it really and truly means. And so I think that that's been fantastic to watch. And so we're baking it into all of our meetings and everything that we do. And many of our members are, or the majority by far of our members are. And so, to the extent that work can continue and not sort of, fall by the wayside, as long as the momentum can continue, I think that'll be fantastic. And so I think that's most important.
Michael, do you have something you want to add before we move on to our last question?
Sure. Just on the issue of equity, I just wanted to say that, I think we know that, health outcomes are affected by much more than just access to healthcare. And, we know that access to food, secure housing are certainly important. And I think one of the things that I think has come to light, it's existed for decades, centuries, but but has come to light is just the effects of discrimination and racism on health. And to fix those issues, those are systemic societal changes that are not, and I think those are, the treatment for those issues is not just access to healthcare. It's changing how we treat people, how we work as a society, and how we get rid of systemic racism and discrimination that totally affects people's health. And so while we want to be able to provide that access to healthcare, I think it's important for us, as organizations that are healthcare organizations, also partner in those systemic changes, societal changes to improve people's health. Because ultimately what we're interested in is improving the health of the communities that we serve. And we want to make that happen however we can. And so, so I just think that's an important point, and it's part of what we want to do even as a healthcare organization.
Agreed. If you'll just indulge me for a moment, we in Contra Costa County actually declared racism a public health emergency. So, if nothing else, it's top of mind. And I think all of you are exactly right about how incredibly important it is to figure out what we do moving forward in a different way than we have for generations in the past. So the last question, I think, really is a great kind of round robin question. So I'll just kind of call on all of you in the order that I see you on my screen. And Patrick, maybe if you could work in here some of the research that I know you did about the latest CalOSHA regulations, I think it fits well here. The question is, with June 15th so close and so many unvaccinated, what advice do you have for both those who are vaccinated fully and those who are not, and perhaps the employers who are bringing them back into the workplace?
Yeah, thanks so much. I won't provide any advice on what vaccinated or unvaccinated folks should or shouldn't do, given that there's a couple doctors here. But I will say that, what we're hearing, and the Bay Area Council member companies are mostly, the largest of employers. But what we're hearing is that this latest guidance is proving pretty tricky for small and medium-sized businesses. They don't have the bandwidth, the HR, the legal teams to know if they can or should or be keeping track of who is vaccinated, who is unvaccinated. Unvaccinated workers should keep on masks, but can serve unmasked, folks at a restaurant. If one of your 10 workers in a group is unvaccinated, then everyone should wear a mask, but can the employer know that or know who's in a room at any given time? We're hearing that's proving pretty tricky, and that there's a fair amount of anxiety, around kind of the reopening and that in particular. And so I think that, I also think it's pretty interesting that the guidance immediately called for an expert panel to be put together to review and reassess the guidelines. So I think that's also really confusing, because imagine you're a small business and the first thing you read is that this should be immediately reconsidered, revised, and changed. And so we're hearing a lot of that too. And so I think that it is going to be difficult going forward, and it is unfortunate that we just can't reopen because there is so much vaccine hesitancy, and so many folks, we did such a great job marshaling the resources. I mean, this is something the United States has always been very good at, to get as many folks vaccinated as quickly as we could. And hats off to Contra Costa County, where I live, where I got one months and months and months before I ever thought that I would. And so it would be great if everyone just, if we had a little bit higher rate of vaccinations and we could reopen. But to the extent that we, continue to need, these kind of nuanced guidelines, it's really hard for the small and medium-sized businesses, and they're already exhausted from, just kind of hanging on, by the skin of their teeth to keep their businesses open and to try and, put together some sort of indoor-outdoor scenario, and now, trying to reopen dining rooms or other small businesses or retail spaces and kind of not knowing what to do. It's tricky.
Laura, any quick words of advice?
I'm keeping my mask.
Well said.
That's very undoctorly, very unevidence-based, but I kind of like it. I mean, I think it's sort of, I think about how do we apply sort of universal precautions that we learned about in HIV. You know, so I think it's okay.
Erin.
Thank you. Yeah, I'll defer to the doctors as well. You know, I think how we move forward is slow. I think that we consider hybrids for our respective companies, and I think that we remain mission driven. You know, the work that we do is about, you know, our communities, our consumers, our customers, and we need to make sure that we're providing the highest quality, regardless of what type of services that you provide. And I think that we lead, you know, from there. I think the other caveat too is really having these questions together. You know, Patrick's right. You know, some entities or organizations may not have those resources or have that infrastructure. And I think that we need to put our resources together so we can figure out, okay, how does this work under OSHA? How does this work under, you know, county policies? And also, I mean, we're in the epicenter of technology, right? But I think that we're also in the epicenter of social entrepreneurship. And with that in mind, I think that there are some solutions that could fit both for, you know, our workforces and create, again, more work forces as some of these monies arrive, both through the ARP, both with the infrastructure money that's going to come, you know, whenever that lands, to get us to where we need to go. Also, we need to remain limbo. Limbo. You know, La Familia, we bought a fleet of mobile units to have, you know, mobile responses in multiple neighborhoods. And I think those are the ideas that we need to continue to push. And with our workforces, we need to have stackable credentials. Aside from, hey, just, you know, having more nurses or having more EMTs, but building that leadership so they could be thought leaders in whatever the infrastructure becomes. Thank you.
Michael, we'll let you have the last word.
Sure. Just in terms of this with our workforces, you know, just really, we have about 1,000, close to 1,000 employees at Lifelong, and just trying to find out who's vaccinated, who's not, so that we can comply with the OSHA guidelines and allow people to get back and interact. A lot of our employees really miss that social interaction from seeing people at work, and we want to get back to doing that, as well as providing care to our patients. You know, we want to do that in a way that encourages our employees to get vaccinated if they haven't yet. That has a culture where people can wear a mask if they want to wear a mask in whatever setting. I personally do think that masking will be with us at some level for, you know, a long time. And there's probably good reasons for that, both for COVID and other communicable diseases. But it's, you know, I think really supporting our employees to be able to have what they need to get vaccinated, and then allow them to also interact in ways that is both good for the services and also good for their own lives and interactions.
Well, thank you for that. And thank you for allowing me to be here today to moderate the panel. And on behalf of the panel, I want to say thank you to the East Bay EDA for having us today and allowing us to have this conversation and sharing these thoughts with your community. So Stephen, I'm going to turn it back over to you.
Thanks so much, Cam. And just want to echo our deep appreciation for the fantastic job that you did and for the panelists today. Thank you all for being here. Make sure to join us 2 weeks from today on June 23rd. We'll have another webinar featuring Dr. Christopher Thornburg of Beacon Economics talking about the state of the economy. It's a don't miss event, so we hope to see you there. And until then, be safe, stay well, and enjoy the upcoming time and take it slow and steady. Take care.